Assalamu alaikum, and welcome back to episode number 11 of Nafs and Therapy. It's been a while, right? And of course, we are more than honored to be hosting Dr. Hooman Keshavarzi on this podcast. He's one of the founders of the modern field of Islamic psychology. He's one of my teachers, and I'm really happy to have him here. And just before we start, as we always do, remember the disclaimers. Remember that this is not personal advice. Remember that, especially if you do currently struggle with OCD, to check with your provider, with your therapist, with your psychiatrist on any thoughts, any feelings that you're having when you listen to this episode. If something that you want to implement, if it's something that you want to run by them, or if it's something that you'd like to process. And feel free to pause, stop, not listen at any point when you feel that this is too much for you, or maybe if this doesn't fit either. And for now, enjoy the episode and let's get started. All right. Assalamu alaikum, Dr. Hooman.
وعليكم السلام ورحمة الله وبركاته.
I want to say how excited and alhamdulillah, super happy and blessed that we're able to record this episode. And I will just start by introducing Dr. Hooman, who is my teacher and is also a clinical psychologist, founding director of Khalil Center in Chicago. And he's currently actually joining from Qatar, from Doha, and where they're currently working on a master's program in Islamic psychology, grounded in Islamic psychology in Hamad bin Khalifa. Would you like to say anything about this program, Dr. Human, since I mentioned it right now?
Yeah, sure. I mean, first off, thank you for the invitation. Happy to be on this show, mashallah. Just as an aside, I think I ran into somebody. I think they were actually applying to our program and the master's program at Hamad bin Khalifa, and they said that I've been, following Sister Noura and her channel and her work, and so I've been learning and trying to apply kind of especially from the work that she does, and she was like, "I'm not sure if you know who she is, but she's based out of Lebanon," and I was like, "Yeah, I know exactly who you're talking about, mashallah." But I was pleasantly, surprised, mashallah, and happy to hear of the work that you're doing and how it's impacting people's lives, particularly in the Arab, world, in the Arab-speaking world, and in the Levant region, mashallah. So
Thank you.
yeah, so I just want to say that, and I know that you and I have kind of, interacted, engaged in so many different settings. You've joined our TIP training, so I've been so happy that you've been
Mhm.
sort of taking the work and the research and the models that we're doing and progressing it forward and making it accessible for so many, individuals in different parts of the world.
Mhm.
And, in several different programs, mashallah, that we have been able to kind of really engage and interact. So I just want to mention that as to how happy I am and to see the impact of this work and honored for me to be on this show with you and have this conversation. So I just wanted to say that before I kind of jumped into anything else.
Thank you so much. And this is means the world to me, Anjad, very much.
Barakallah feek. Barakallah feek. Yes. So the Hamad bin Khalifa University program, actually, I've been here in Qatar for about a year now. And it's actually the first program that I know of internationally that is a counseling or clinical psychology program that is applied, training mental health professionals to become licensed practitioners to work in mental health settings, hospitals, outpatient settings, etc., that is grounded in Islamic psychology. Its foundations is an Islamic psychological approach, is an Islamically integrated approach, alhamdulillah. So I've been kind of privileged to be a part of this program, which is very unique and kind of visionary, and invited to kind of join as a program director here. So I've spent about a year and we've been working with the first year students who finished their first year. Now they'll be going into clinical practice in their second year, an internship, as well as working on their theses. And now we have a new cohort coming in, and our semester is going to be starting next week. So, alhamdulillah, I've been here for about a year. It's a very brand new program, certainly a lot of refinement that we're gonna do and have as we grow and progress through the program. But alhamdulillah, it's I think it's a huge sort of step in achievement for the Islamic psychology movement, really internationally, to have a mainstream university with accreditation that is
Mm,
going to be licensing our graduates through the Ministry of Public Health here and working in mainstream, healthcare settings here in the Gulf region. We're
mm,
attracting international students from everywhere in the world, mashallah. We have people from all over the world, Arab-speaking world, from the West, from the United States, Canada, England. People are coming from really all over the world to try to join these programs, quite competitive actually. And so
mhm.
it is an exciting endeavor that I just want to kind of share that for people that may not necessarily be aware of the developments in sort of education in Islamic psychology.
Wow, that's yeah, and did not know that you guys actually started with the first cohort, so that's really so impressive.
Mhm.
That the first year has already passed by, and I can imagine how really useful this is going to be to, especially for those of us who are going to be working in this region. And inshallah, when you do a PhD program, I would be more than honored to join. I would love to apply. I think hopefully the staircase shows that it's probably going towards that direction, inshallah,
Inshallah.
possibly a PhD. So one of the million things that I thought I would love to talk to Dr. Human about are from from Islamic psychology to the field development to the history to the applications, but specifically, and for me, I think one of the main things that I think it's the forte of Khalil Center or even your work is the work on OCD.
Mhm, mhm.
And I already share the toolkit of working on OCD, and I would love to hear from you if you could like guide us. If a listener is hearing this is probably thinking that he might have religious OCD, how do we usually go about it when it comes to working in the clinic, whether diagnosing it, whether seeing it, or even in just observing?
Yeah, yeah, no, absolutely. Happy to talk about this conversation about OCD. And it actually is a good practical demonstration of what, sort of an Islamic approach to understanding, a very specific kind of clinical diagnosis and pretty common problem that occurs among Muslims. So I think
Mhm,
it's useful, it's practical, it's something that people can probably take away and find some utility for rather than talking very theoretically. And by the way, OCD, the lectures that we've given on OCD that have been online are the most watched
mhm,
videos that we've actually put out there. So it just kind of speaks to how much of it is out there that may not necessarily be showing up in clinical settings. So maybe what we can do is we can just kind of talk about what is OCD first and then
mhm,
kind of distinguishing between clinical manifestations and its different sort of subtypes. So OCD, as the name entails, obsessive compulsive disorder, entails two parts. One is where there's obsessions, and there are usually these cognitive or mental ruminations, these thought patterns that go through an individual's mind that evokes a fear-based response, anxiety, and that anxiety then leads them to the second part, which is compulsions, engaging in some sort of compulsions to be able to reduce that anxiety. Take an example, a non-religious example would be like somebody has OCD about leaving the stove on, for example,
mhm,
or locking their doors, for example, particularly if they live in unsafe areas. They may become preoccupied with locking the door and they leave the house, they've driven away, and then they start to think, "Oh, I didn't lock my door." And then all of a sudden they start to go through this snowballing
mm,
in their mind of somebody's gonna break in, somebody's gonna steal my stuff, and they catastrophize. They say somebody's gonna steal all my stuff, they're gonna burn my house to the ground or something like that, and they become very afraid, which then creates a lot of this fear, anxiety, and nervousness in them. And then that nervousness pushes them, right, to reduce that anxiety by coming back and checking and making sure that the door is locked. Now, that might just be a natural reaction for somebody in an unsafe area. For example, where I was living and where our Quill Center national headquarters is based in Chicago, Illinois. It's one of the, crime and murder capitals. Unfortunately, one of the things that
Mm,
among the beautiful things that Chicago's known for, one of the sad things that Chicago's also known for is high crime rates.
mm,
And so somebody may be concerned about this, and in Chicago, they might have a legitimate worry to say, "Hey, I forgot to lock my door, forgot to lock the car door," and then they come back and check. That's not abnormal.
mhm,
What's abnormal is when they come back 5 or 6 times,
mhm,
or they checked 2 or 3 times, and then they leave, and then they think, "Oh, but what if I didn't pull the handle properly? Or what if it unlatched when I was leaving? Or what if I forgot one of my extra keys under the carpet or something in front of the house, in the plant in front of the house?" So they get all these different ruminations, these obsessions. So that's why we call them obsessions. They become fixated on one particular thing, and then they start to worry about it a lot, worry and worry and worry, and then they start to create the cycle where they actually end up spending a lot of time, such that it is at least an hour a day, and it affects their functioning, meaning they're spending a lot of time, an hour, 2 hours, 3 hours, just checking the locks. And it may be checking the locks, it may be checking the stove,
mm,
it may be also cleanliness, for example, maybe 1 or 2 or 3 things, and they're afraid of bacterias, for example, getting in this. Also, they obsessively clean, and then they have to re-clean again if, somebody touches a surface and they hadn't disinfected their hands, for example. It becomes this cycle. And there's a
mm,
difference between, again, somebody who's a little bit obsessive and preoccupied with cleanliness, right? And
mhm,
of risk averse, between that person and a person who is preoccupied and dysfunctional with this kind of thing. That's what we call OCD,
mm,
kind of disorder. That's when we call it a disorder because it impairs somebody's functioning. The other element, the layer that maybe we can talk more about that I see a lot and that we specialize in is what we call like a religious OCD, right? Or what we call the literature calls scrupulosity.
mhm,
OCD scrupulosity. Scrupulosity is the interaction between OCD, the disease of the OCD, just as I described, obsessions, worries, and compulsions, and religion. And
mhm,
so it's not that religion is causing this, right? Some people make a mistake and say, oh, religious people are just obsessive. That's why they're more prone to OCD. That's actually not true. Usually, people who are prone to OCD will, like, you can think of it as the clothing or the context that covers that person, right? If they're
mhm,
religious, then the things they will be worried about will be religious things. If they're
mhm,
not religious, the things they will be worried about is not so religious things, right? Like cleanliness, safety, you know, health, etc. And so in the case of religious OCD, what ends up happening is that we have people who tend to make wudu, for example, over and over again, make ghusl over and over again, pray their salah over and over again, renew their nikah over and over again if they're married,
mm,
renew their shahada, right? Their iman, because they think that they've committed kufr over and over again. And these are the things that they become very preoccupied with. Another feature to note, I'll say this and then we'll pause for a moment to hear your thoughts and questions,
mhm, mhm,
is that people with OCD tend to know that they have a problem. Meaning, it's not just I am more obsessive about cleanliness. It's not that I'm just more careful about my prayers and the quality of my prayers. They actually think, they actually know that this is a problem and they don't want this to happen. It's an unpleasant experience, meaning they look at other people and they make wudu once and they pray their salah. They look at other people and they're able to have a healthier relationship with their spouse. They look at other people and they're able to have a healthy relationship with their faith and iman and they're not too worried about it. And they kind of recognize that this is problematic. Like, how do I get these thoughts out of my mind? And how do I stop feeling the way that I do?
Mhm.
because I can't help it. And I need almost like this itch, like if you have a scab on your arm, you
Mhm.
know you shouldn't itch the scab. If you do, then it'll bleed and it won't heal. But you have this urgency to like, I have to itch the scab in order to feel comfortable. I can't feel comfortable. And they say, and they know that they shouldn't be doing this, that this is not healthy. They know that making wudu 15 times before every prayer is not normal. They
Mhm.
know that making ghusl for 2 hours is not normal. 3 hours, it's not normal. They know that, repeating their shahada and then worrying that they nullified all their contracts because they committed potentially kufr and blasphemy, they know it's not normal. And so they are actually willing to get help, but the difference is that usually they don't show up in mental health settings as much. They usually go to religious leaders. And the reason
Mm.
why is because think about it, if they're afraid of committing kufr or sinning, right? Then they don't want to go to somebody who's a professional who's going to tell them it's okay, don't worry about it. They
Mhm.
want reassurance from a credible religious authority usually that tells them, "Don't worry about it. What you're doing is like, you shouldn't do that, or you should behave this way." They wanna be told what is religiously acceptable, and they don't necessarily trust mental health professionals to be able to do that. And they would rather, right? They would rather suffer through the mental illness than the possibility that they get help, but they're gonna go to hell and Jahannam. Do you see what I'm saying? So that's
Wow.
why so that's why they would rather not go to a mental health professional and keep up their dysfunctional lifestyle because it feels safer than to go to a mental health professional who may say, "Stop doing this," and they stop doing it, and then they start to question whether what they're doing is wrong. You see what I'm saying? Like, if you go
Uh-huh.
to a mental health professional and you say, "I pray 15 times a day and they're for each salah," and they're like, "No, don't do that. I'm gonna help you stop doing that." They may wonder to themselves, "But what if my prayer didn't count?" And then they say, "Okay, don't worry, that's an anxiety. Get that out of your mind. Be comfortable with it. Embrace it. Have these coping mechanisms." And then they say, "But what if the reality is that I'm going to hell now, because of
Yeah.
that? It's that I'm just making myself feel comfortable." Do you see what I'm
Mhm.
saying?
Mhm. Which is
Yeah,
valid. Like it's a totally valid concern, right? Of them wanting to make sure that what they're engaging in is not actually just a pat on their back, but they actually want
exactly.
something that speaks to them. And I when you were talking, and I noticed that I noticed these a lot in my clinic. And I noticed just the obsessions without the compulsions, if you notice that as well, of just like obsessions of thoughts about you're not pious enough. If you stay on this path, you're gonna lose everything. Maybe religion is not real. Like these obsessions that come and they're disruptive,
Yeah.
but the person doesn't do anything to compulsory, if I can say, to act upon them. But do you think this falls under the same category that we're talking about?
Yeah, so usually for OCD, it requires a compulsion, and the compulsion, it doesn't necessarily have to be, a behavior, although usually it is. It
Hmm.
may be speech. For example, I'll give you an example. Somebody's afraid of committing blasphemy, or let's say that, let me give you another example. So somebody is afraid of divorcing their wife, right? Because we know in Islam that, a male directed towards his wife, the way to divorce your wife would be to verbally like say it and direct it towards your wife. And there's two forms. It's one that's sarih and through kinaya. Sarih is
Mm.
very clear where you actually use the love, the word divorce or talaq, for example, or it's figurative where an individual says something like indirect, meaning they say, "Go back to your parents' house. I never want to see you again," with full intention in their mind. Again, this requires an intention that they are committing a divorce, that they don't want to do that, they don't wanna be with this person anymore. So, I'm just giving the context for our listeners who may not necessarily know why somebody would be obsessed about divorce. How does that work? Because you usually would have to go to a court or something, but no, a religious divorce usually happens through a verbal pronouncement, not necessarily something that needs to be written or adjudicated through a court process. And so if somebody so somebody may worry, like, for example, I had a patient of mine, whenever he read the Quran, he couldn't read Surah Talaq, or whenever the word talaq came up in the Quran, he wouldn't read it. He'd just skip over it.
Mm.
Do you see what I'm
Wow.
saying? So this is a compulsion, right? It's a compulsion, even though it's not necessarily showing up in this kind of behavioral way. Or when he's talking to his wife, or I have patients who barely talk to their spouse because they're afraid that they might accidentally divorce their spouse or say something because, they have this false notion in their mind, right? They think to themselves, if I say divorce, sorry, no,
Mm.
sorry, if I say anything to them, but then at the same time in my mind, I think divorce, right? Then that's my
Oh.
intention to divorce them. So if they're arguing with themselves that, or even if they're joking, they say, "Oh, get away from me, or don't touch me right now," right? They say something like that to their spouse. And then at the exact same moment, they think to themselves in their mind, divorce. And why would they do that? Because usually people with obsessions and ruminations, the very thing that they're afraid of, they think more of. So they get more of those
Mm.
thoughts. So for example, if I tell you don't think of an elephant or pink elephant, what's gonna happen? You're
Yeah.
gonna start thinking of it a pink elephant. Do you see what I'm saying? And so they always say to themselves, "Don't think about divorce, don't think about divorce." So what happens? They become obsessed with thinking about divorce because every time they tell themselves not to think about it, they're actually engaging and enabling the process even more. So they may just change their speech. So they think, "Oh, I'm just not gonna speak to my spouse because what if I say something accidentally and at the same time I think that same thought?" The thought of
Mm.
divorce, that means I indirectly divorce them. And even though it's not rational, usually they're afraid of the possibility, not the probability, right? They say it's possible. Even if you say, "Does this make sense?" You say, "Yeah, probably not, but it's possible." And therefore they engage in this kind of like of what usually what we call, like, it can be a compulsive behavior, like making wudu again, or repeating your shahada again, etc. Or it can also be avoidance behaviors, where people
Mm.
avoid certain things that may trigger their ruminations or their fears. Does that kind of make sense? So usually there is
Mhm.
some kind of process that they're engaged in, even if, and then there's another layer, which is mental compulsions, where they may mentally try to convince themselves that it's okay in their minds, and that's usually called what we call like a cognitive neutralization. So they start to have this like conversation in their minds to make themselves feel better, but it becomes this ruminative obsession that just keeps coming over and over again. But there's a compulsion. There's usually a cognitive compulsion, mental compulsion, or there's usually an avoidance behavior or some kind of like tangible behavior that is compulsive.
Yeah. Oh, wow. That's really, I love the kind of intersection of everything and how it comes together towards ending up with this is not really benefiting me in whatever way possible, and still I can't seem to stop it. And
Yeah.
I know that throughout our work and throughout TIP, we've talked about the inner critic
Mhm.
and a meeting with the inner critic, and sometimes how this inner critic can also be playing a part in having this OCD linger for a bit more.
Mhm.
Do you think you can describe those intrusive thoughts as like their underlying inner critic, as if?
Yeah. Yeah, so yes and no, so both. So there's a part of us that has critic, right? We all have this like, there's like various ahadith on this, like for example, they say the nafs al lawama,
Mm-hmm.
from Laum, يعني يلوم نفسه, like it continues to criticize or blame the self, right? That's sort of one
Mm.
stage. And then there's like another hadith that talks about, الواعظ في قلب كل مسلم, right? So that there is this admonisher, right, within the heart of every believer. And there's this itch, right? الإثم ما حاك في نفسك وتردد في القلب. That sin is something that like scratches at you and you feel hesitation in your heart with. So
Mm,
there is this natural critic, and even modern psychology kind of some schools, particularly EFT and other schools, talk about this critic, although they don't necessarily have a full fledged conceptualization of it, just because the idea of shame and criticizing the self is usually seen as bad in Western psychology. And so it's hard for them to kind of conceptualize it, but they do
mm,
have some conceptualizations of it. Some of the more positive approaches talk about, criticism, self-criticism allows you to be more consistent with your values and your goals, right? So if we don't
mhm,
criticize ourselves from, let's say you want to be a psychologist, you got to do a graduate degree, master's degree, you have to do some clinical training. But if you think to yourself, oh, who cares? It's okay. I'll just, do a, weekend certificate coaching program and I'll just call myself a psychologist, then, you're kind of, you need to have a self-critic that tells you that's not good enough. Like you're kind of, putting on an act here. Like you need to be a little bit better than that. You need to actually go through an official process. Or if you're lazy, you're not studying, then your critic tells you you need to pay attention, you need to study, right? So if you're not taking care of your kids, you criticize yourself, you say you need to be a better mother or father. These are good things, right, for ourselves to feel shame and induce shame within ourselves to grow. And similarly, all human beings have this. And in Islam, we say that there's this part of us that tries to call our attention to when we are doing something wrong. It's our inner conscious, it's in our inner voice that tells us, you know, when you do this, that's bad and you need to correct that behavior. Um, but then there's the waswas of shaitan, okay? And the waswas of shaitan is a more of a metaphysical external force that what it does is it interacts with your critic. So if your critic is either is too harsh, right? Or you have unreasonable or unfavorable vulnerabilities within your own self, then shaitan comes and pokes at you with those vulnerabilities. Okay? So for example, and usually what it has to do with is the fear of loss. You're afraid of losing something. Typically we want to, we want to be a good Muslim. We don't want to value our health, value our family members, value being a good person. And so Shaitan comes and whispers into us things that are already sort of hang-ups or concerns or fears that we have, and he just amplifies them. And he just itches them or scratches them for us. And so as the Quran says, "Ash-shaytanu ya'idukum al-faqr wa ya'murukum bil-fahsha." That shaitan comes and he promises you with faqr, poverty, or we can think of faqr also as fear of something you value, like things that you value. You value your iman, you value your health, you value family, right? And so shaitan comes and tells you, you're gonna lose these things, and that's usually what OCD is about. It's about a fear of losing something that I value, my iman, my relationship with Allah Ta'ala. And then shaitan comes and will kind of exacerbate that or magnify that. And then once you feed into it, right? And وَيَأْمُرُكُم بِالْفَحْشَاءِ, and he commands you to do that which is evil, which looks like it's a good thing. He usually cloaks it in a good thing. Okay, I think I didn't pray my salah properly, so I should make my salah again. Seems reasonable, right? Um, but then he tells you to do it over and over again, continuously and continuously. And so you end up what? Not having actual khushu' in salah, and in anxiety, we call this a Yerkes Dodson law, the law of diminishing return. So, we all have optimal anxiety, optimal criticism. You criticize yourself at a healthy range. But when you criticize yourself too much and you open up the pathways for shaitan, then you actually have diminishing return, meaning the very thing that you're afraid of, you actually make happen. So, for example, I'm afraid that my salah doesn't count. I'm afraid that I'm going to be disconnected from Allah Ta'ala, but what are you doing? I'm wasting water by making wudu 15 times. That's israf al-ma, right? You have no khushu', no concentration in your prayer because you're so focused on the rituals that you actually don't focus on the prayer itself. Do you see what I'm saying? You become fixated with the rituals. Sometimes I call this, to my patients, I say, you're worshiping Islam and not Allah Ta'ala. And they're like, What does that mean?" I say, "Well, Islam is to facilitate the rules and the rituals are to facilitate connection with Allah Ta'ala. But you're worshiping the ritual itself, right? You're obsessed with the ritual, the way of praying salah, as opposed to worshiping Allah Ta'ala Himself, right? So people with OCD, they tend to operate a religion in a way like it's like a keypad lock approach. Like if I have a code, I have to press the right code, 5056 in order for the door to open. But Islam doesn't work that way. It's a ritual. It's not this keypad lock code approach. In fact, it's the mercy of Allah Ta'ala. So it's not that you press this. Sometimes you may press the keypad, get the correct code, but the door won't open. Meaning, sometimes you will pray your salah, but there's no sincerity in it, no khushu' in it, but you did all the rituals properly, but it's not accepted. Do you see? But sometimes you pray your salah and you make mistakes in the rituals, right? And the door opens. Because of the mercy of Allah Ta'ala, the door opens and it's accepted. Do you see what I'm saying? It's like the Prophet ﷺ said, you know, none of your ibadat worship will be rewarded, meaning you won't get Jannah because of your deeds. And they say, not even you, Rasulullah? The Sahaba asked. He said, not even me, except that Allah Ta'ala is mercy envelops us. So it's not like a one-to-one relationship. I did this, therefore I deserve this reward. I did this, and therefore this door should open. It's not a one-to-one arrangement. It's you do that, and then you rely on the mercy of Allah Ta'ala. That's the part that people with OCD really struggle with because it's the part you don't control. It's the ambiguous part, right? That they have a difficult time with.
And I want to build on that specifically, or on that specific example of, um, h- or how can someone, if you notice with patients some kind of spiritual breakthrough that happens where they could actually get this connection, or not necessarily feel bad that they're wasting water or that they're not having khushu' in their prayer, but to actually go like for this spiritual side to kind of be um uplifted, that would
Yeah.
support kind of this. I'm curious to know how do you usually work on the spiritual end that
Okay.
supports the patients with OCD, especially those who are like having already a hard time with Islam
Yeah.
sometimes.
Yeah. So this is a very good question, actually. And actually, it's about starting with their nafs and their compulsions before you can facilitate ease in their spirit. And what I mean by that is that, so think of it this way, like if a person wants to, I don't know, like enjoy going for walks in nature, right? This is the analogy. But they're so out of shape and they're so unhealthy, right? That as soon as they step outside and they take a few steps, they're out of breath. They're tired. Their muscles ache. They feel hot, right? They can't stand the sweat, for example. Are they going to be able to enjoy the beautiful scene and scenery of what's around them? No, right? So the issue is that they can't enjoy it because their body is really sick. And so they can't appreciate, right? Like psychologically and spiritually, like the beauty that's out there. And so we're integrated whole human beings, right? So one thing affects the other. So I actually think it's more of the other way where it's like this. People with OCD tend to over focus on the feeling. And what we want to do is to actually not focus on the feeling at all, actually, to the other extreme. So, for example, they'll say, I need to feel like my prayer counted, or I'm going to pray until I feel that it counted. I'm going to make wudu until I feel like I have wudu. Do you see? This is a problem. It's a trap. And so we actually don't want to engage the feeling element as much, but what we want to engage is more of the behavioral compulsion, which they control. So I tell them, you don't control your feeling, but you do control your compulsion. You don't control your thought. You don't control the thought that comes to my mind that I didn't make my wudu didn't count, or I broke my wudu, or my prayer didn't count, or I committed blasphemy or not. You don't control that thought. But what you do control is a compulsion. You control whether you make wudu again or not. And you control whether you make salah again or not. And so what we want to do is to help you and prevent you from engaging in the compulsions. And health in OCD is indicated by the degree of compulsions they engage in. So I say to my patients, the difference between you and I is not that I don't have bad thoughts like you do. I have evil thoughts. I have sinful thoughts. I've thoughts that come to my mind that are thoughts of kufr, thoughts of bad things towards other people. We all have a shaitan with us, waswasa, right? Everybody in the shaitan yajri min al-insani kama jadam. All shaitans runs through the blood flow of everybody. So everybody's gonna have this. We're the same in that regard. The difference between me and you is I'm not scared of those thoughts. I'm not worried about those thoughts. And I don't act upon them. The moment that you act upon those thoughts is when you're sick. So if you have 15 thoughts of kufr, but you do nothing about it, you don't have OCD, right? And this is actually the hadith of the Prophet ﷺ. He says, when the Sahaba came to the Prophet ﷺ and they said, we have such thoughts that go through our minds that we're afraid to articulate them on our tongues, and that we would rather put this like burning coal in our mouths than to articulate them. He said, do you really experience these thoughts? They said, yes. He said, ذَاكَ صَرِيحُ الْإِيمَانِ. That is clear iman. Why? Because shaitan comes to a person with iman. Like, if you are value iman, shaitan's going to come and tell you, you're going to lose your iman. Do you see what I'm saying? He doesn't go to irreligious people and say, you didn't pray your salah properly, because the person doesn't care to begin with. You see what I'm saying? So we have to combat repeating, and when we stop the repetitions of the prayers or the wudu over and over again, then you start to have a reduction in the level of anxiety, and then they get used to it. Like, meaning it's like training. It's like this itch, the healing of the scab starts to go away. Or it's you're training your muscles, your nafs muscle, not to itch, not to continuously engage in this behavior. The more you do it, the more in the beginning, it's going to be excruciating, meaning you will be uncomfortable in your prayer. You will feel uncomfortable for half the day, but you have to force yourself not to engage in that ritual, in the compulsion. That's the key to combating it. And then after you achieve that, then you will be able to appreciate and enjoy prayer and khushu and connection with Allah Ta'ala, because you've overcome the handicap that's kind of clenching you or grabbing you from preventing you from being able to actually engage and be present in your prayer because you're so afraid of losing your prayer.
I want to check in if at any point there you differentiate between maybe thought like me with obsessive thoughts that are coming from oneself and shaitanic waswata.
Yeah, I mean, so thoughts, the differentiation between thoughts of what you're thinking in your own mind and waswasa. I mean, in the case of OCD, typically what we do as an intervention is we say it's all waswasa, it's not you. And so we actually externalize it. So the you part, so here's the example. The you part is I value and care about Islam, right? And I value my prayers, and I fear Allah Ta'ala, and I fear being punished. I fear losing my iman. Okay, that's the you part. Shaitan is the part that says, this particular prayer, right, you did not pray properly, and if you do not repeat it, it will not count, and you'll be going to hell as a result of it. You see? So what it's doing is, well, a person who loves their salah, loves Allah, says, I love Allah. And if shaitan comes and says, well, as a demonstration of your love of Allah, you need to repeat your prayers, because how could you be okay with a prayer that doesn't count, right? Then that's the kind of difference. That's like the waswas of That's a waswas shaitan. What's useful about this is this. So I use an intervention, for example, like this. I say this, for example, you know, when you're praying your prayer, right? You go to pray your salah. The salah that you pray, the very first one you pray, why do we pray it? Let's say salat.
Mhm.
Why do we pray Salatul Maghrib?
We have to? It's
Yeah, yeah.
فرض,
I
it's
mean,
time, right?
yeah, it's the time for
Mhm.
salah. The adhan has been called. If you're in a Muslim country, the sun is setting. The sun has set or is setting, um, and the time has come in. And Allah Taala commands us that, you know, عند غروب الشمس, right, at the time of the setting of the sun, that's when the indicator of a prayer time is, and you must pray these, right? So that's necessary, right? We have to pray it. So then we're responding to the command of Allah Ta'ala here, right? To pray that salah. So then I get up and I pray that first salah. But when I prayed the second time, right? Who told me to pray the second time?
I see.
The second prayer is not because of the command of Allah Ta'ala, it's because of the command of whom? This is waswas of shaitan. Shaitan comes and he says, you should pray your prayer again because you didn't do it properly. And then, so when you pray the second prayer again, whose call are we responding to? The call of shaitan. Do you see what I'm saying? So I say this to people as a reciprocal inhibition because you know what they say? They say all people with OCD are afraid of safety, right? They say, I would rather be safe, right? And pray again so that my prayer counts. But I say to them, no, praying the second prayer again is not safe. And you know why it's not safe? Is because the first prayer was for Allah Ta'ala, your second sujood was for shaitan. You see what I'm saying? And then they say, oh no. And I say, yes. So do you understand why we're going to stop you from praying those second prayers? In fact, let me share with you a statement because a person may say, where are we getting all this from? An example from the famous tabi'i who was the grandson of Abu Bakr as-Siddiq radiallahu ta'ala anhu, and his name was Qasim ibn Muhammad. And somebody came to him and he said that I have doubts about my prayer and this keeps coming to me regularly. Okay, so this is the modern intervention I'm talking about. This is actually found within our tradition. And so, what did Qasim ibn Muhammad radiallahu anhu say? He said, continue your prayer, for it, meaning the doubts will never leave your mind until you finish your prayer while still feeling that you haven't completed your prayer. Meaning, you shouldn't break it. You should continue your prayer, and the doubts will still continue to afflict you until you are able to proceed with your prayers and not pay it any attention. Meaning not respond to it. Not respond to it. You can't eliminate the thoughts. You can change your response to them. Not the thoughts. You can change your response to the thoughts. In the commentary on the statement that's brought in the Mishkat al-Masabih, there's a commentary on this by Malali Qari in his Mirqat, in which he says even further, he exaggerates this even further, and he says, yes, in fact, even more so, a person will continue to be afflicted with ruminations and thoughts until they say, yes, in fact, I have not completed my prayer and I didn't do it properly. However, I will not repeat it or complete it at all. So leave me alone, to the shaitan. And for indeed Allah Ta'ala is kind and He will accept from me the deficient prayer. Do you see? So in OCD, we have this perfectionism. Like we have to continue to pray over and over again and be perfect and do it exactly in the way that we. No. Maulana Qadi is saying, you say to the shaitan, Allah Ta'ala is perfect, human beings are imperfect. I did my best and it's deficient, and I pray and hope Allah Ta'ala will accept the deficient prayer from me. And I'm not going to repeat it again. Because who you talking to? Shaitan is the one that's telling you to do it again. So this we call in ACT, right? ACT calls this like externalization. So they say externalize these thoughts. Not every thought is your own, right? So they say it's not your thought. Just because you thought a blasphemous thought doesn't mean you're a kafir or you committed kufr or that you're committed blasphemy. Just because you thought an evil thought doesn't mean you're an evil person. So then, but they don't give a source to it. So they don't give you a difference between, well, how do you know which one's your thought, which one's not? We have a source for it. We say it's shaitan, right? Shaitan is the one that puts those evil thoughts in us. So, for example, so a person has a desire, they like meat, right? Or let's say a non-Muslim has been used to eating pork. Their nafs likes pork. Shaitan comes and says, eat pork, right? Eat pork is delicious. Pork is like this and that. It's not a big deal. Shaitan is putting that thought in there, but I like pork is something that the nafs has. Do you see what I'm saying? But it's not my thought or my belief. It's shaitan that's saying this to me. And that allows me to separate between I'm a bad person to shaitan is the evil force that is trying to confuse me and make me think I'm a bad person.
Which actually, I felt like this is one of the things that I really wanted to check right now is the difference between if somebody went and they did typical OCD treatment by a secular therapist
Mhm.
who would kind of understand maybe the content if the patient did describe, and between doing it Islamically within like TIP or
Yeah.
other clinics.
So your question is what is the difference? Like how would they
Yeah, like do they report, for example, I'm not sure if there are studies about this, doing better if they went to if they have a religious OCD and they went to a Islamic based therapist and the treatment there would have benefited them more?
Yeah, so
Hmm.
we don't have data on this yet. The thing is
Hmm.
that, Islamic psychotherapies are quite new. I mean, while we have data for TIP model in general, we don't have it for specific modalities. In fact, we're in the process of conducting a study right now, and I do have a a student, a PhD student of mine, who's doing this as a dissertation, in which he's taking our OCD treatment manual and protocol and the workbook and using it with Muslim patients and comparing it against secular psychotherapy. Our hypothesis is that it would work much better. And part of the reason for that is because people with OCD and scrupulosity, when they go to somebody secular, it may not be as effective in them being willing to stop their compulsions in the same way that a religious intervention would. So for example, the example I gave you, like the second sujud is for shaitan, right? Or the principle in Islam, al-yaqinu la yazulu bishak. So for example, we use this treatment principle and we say that they say, well, how do I know whether my prayer counted or didn't count? How do I know whether I committed blasphemy or not? How do I know whether I divorced my wife or not? How do I know if I broke my wudu or not? Because they're like, it's certainly possible that I broke my wudu, and it's certainly possible that I did these things. And we say, yes, that's true. So what we say is, it needs to be definitive, not just the possibility. So meaning it needs to be in the form of a statement. Broke my wudu, not I think I broke my wudu. Maybe I broke my wudu. Possibly I broke my wudu. And this is a religious principle, right? And in fact, religiously acting upon shak, right, is not permissible. Do you see what I'm saying? Acting upon doubt is not permissible. So we have much more basis and credibility to say to them, actually, you're flawed in the way that you're thinking of this. The way that we're inviting you to think differently and restructure your orientation towards the way that you understand your compulsions is actually a fundamental shift. It's not just a psychological exercise, it's a religious psychological demand, right? It's a religious psychological sort of shift. Like there's a that religiously this is unhealthy. Do you see what I'm saying? So religiously this is frowned upon and that you're not supposed to actually be doing this. And so for them, they say, oh, okay, well, if what I'm doing is flawed and acting upon shak is wrong, then I know that what I'm doing is definitively bad, right? And so now there's half the battle is won. The other half is trying to get them to shake those compulsions. But what feeds those compulsions is usually these thoughts that rationalize or enable them. And when you go to a secular therapist like ACT, they might say, well, not all thoughts are yours. And so it's okay if you had a thought of kufr, it's not yours. But then they think to themselves, but what if it is my thought? How do I know? Do you see what I'm saying? And then they say, "Well, it's not. You choose which ones are yours." And then they say, "I don't know. I mean, like, is this valid?" Like, do you see what I'm saying? They think to themselves, "But, like, is this my heart? Is this my i'tiqad belief? Like, I don't know." And then it becomes confusing to them. And so they say, "Okay, well, let's," and usually secular therapists will say, "Well, do you think God wants you to act this way, right?" And it's a good question. They say, "No, I don't." But they lack this sort of like religious credibility. Do you see what I'm saying? To be able to speak from within the tradition as opposed to speaking from outside the tradition, saying, look, it's about functioning. And if you're not functional in your religious practice, that's unhealthy. We need you to have a healthy religious practice. And while it sounds reasonable for them, they just like, I don't know if that's legitimate Islamically. Like, I don't know if I'm doing something right or wrong here. Do you see what I'm saying? And so they need to learn the principles from from within the tradition, like the default in Islam is positive, or the how the Prophet ﷺ, for example, had a practice of sprinkling water over his undergarments after he relieved himself. Why? That's actually an inherent exposure remedy. The Prophet ﷺ is teaching us that you may think that you're leaking all the time and you keep checking. So you're not supposed to check. In order to prevent checking, sprinkle water on yourself so you confuse yourself. And then the answer is, well, but what if it was actually that moistness was due to urine that came out? I broke my wudu, my prayer doesn't count. But what the beautiful thing is that النادر كالمعدوم. The shak is like it doesn't exist. So even if it happened, it's as if it never happened because this is spiritual worship. It's not physical. Do you see what I'm saying? It's not about the tangible. Like, for example, when you make wudu, if you don't have water, what do? You make tayammum, right? It's not a literal purity, is it? Because what if you smell like BO? What if you never showered for 5 days? But then you use tayammum. Are you clean? You're not clean hygienically, but you're clean ritually. Ritually, you're clean, right? They overlap, but they're not always the same. Sometimes they overlap, sometimes they don't. And so sometimes you may not physically be in a certain state, but hukman, the hukum on you is that Allah Ta'ala will accept this from you. Inshallah Ta'ala. We say Inshallah Ta'ala with the mercy of Allah Ta'ala. But yeah, maybe we can come to kind of some concluding thoughts. I know that our time is.
That's great. And I honestly, so far this is so useful, and I think it's going to be really helpful for those not necessarily just who are struggling, but anyone who's interested in this. And I would love to know if you had like just one advice for someone, or like one piece of wisdom. I know we can't wrap it up in a bow tie with
Uh-huh.
someone who's struggling with OCD, and it's specifically religious OCD. If you have like one advice for them.
Yeah. Yeah, my advice would be honestly, this is not something like if you've come to this point in which you are really struggling and hopefully whatever I'm saying like resonates with you and you feel like, wow, that's clicking. And I really wish I could just do what he's saying easily, but I feel that it's so hard to actually kick these compulsions or to cut it out or to not feel that uncomfortable. What I would say is it's not gonna happen overnight. OCD is a it's a struggle in which you make step-by-step strides. So it's okay to understand that this process takes time and that it is a struggle and it gets worse before it gets better sometimes. And I would say you don't have to deal with that alone. I would say get help. Because and particularly for Muslim practitioners who are sensitive to your religious beliefs and values, get help from them You can turn to our workbook. It may help you if you don't have access to a therapist, but it would be best utilized with a therapist or somebody who was very, like, psychologically minded. Go to them, help get them to help you because usually we become kind of wrapped up in our own habits that it's hard to kick without the appropriate support. So I would say use the available supports around you and from people, and use the resources that are accessible to you through the workbooks and things that we have available to then help you kind of conquer this, inshallah. And the hope is I've worked with a lot of OCD. People get better. It's one of the things I actually enjoy working with, and the reason why is because you actually see a drastic shift in the lifestyle of the person. Like, with some diseases, depression, certain personality disorders, you may not necessarily see as much change, or it may be very slow, or it's very difficult. With OCD, you actually see people's lives get turned around. So there's hope. There's hope. There's treatment, and the treatment works. It's very effective. Inshallah.
Lovely. Inshallah. Thank you so much, Dr. Hooman. I'm going to be linking down in the show notes the resources that they can use. And if somebody wants to reach out as well, I'll link some handles. Thank you so much for your time. I really
My
appreciate it.
pleasure.